It was 1789, and a London apothecary named William Brooks was running out of options. His patient, a dock worker from Southwark, had a gash on his forearm that had gone septic. The wound was leaking pus, the skin around it had turned a dark, angry red, and the man's fever was climbing. Brooks had already tried the standard treatments of the era: mercury compounds, vinegar washes, lancing and draining. Nothing was working, and the infection was spreading toward the man's elbow. So Brooks did something that most of his university-trained colleagues would have mocked him for. He walked out to the patch of weeds behind his shop, pulled a handful of a small, unassuming plant with tiny white flowers from the damp soil, crushed it into a paste, and packed it directly into the wound. Within 3 days, the swelling had gone down. Within a week, the infection had cleared. The dock worker kept his arm. What nobody knew at the time was that the little weed William Brooks had used contained chemical compounds that would take modern science more than 200 years to identify. Compounds that behave in laboratory conditions, remarkably, like antibiotics. The plant was chickweed, Stellaria media, and this story is not unique to one London apothecary. It stretches back more than 1,000 years across multiple continents through dozens of unconnected medical traditions that all arrived at the same conclusion about the same overlooked plant. But this story doesn't start with a London apothecary or a dock worker's infected arm. It starts with dirt. Chickweed is one of the most common plants on the planet. It grows on every continent except Antarctica. You have almost certainly seen it, and if you have a garden or a lawn, you have almost certainly tried to kill it. It is a low, sprawling annual with small oval leaves and tiny white star-shaped flowers, each petal split so deeply down the middle that 5 petals look like 10. It rarely grows taller than a few inches. It favors cool, moist conditions, disturbed soil, the edges of farm fields, the gaps between paving stones, the neglected corners of backyards. Botanists classify it as Stellaria media, a member of the carnation family. Most modern gardening guides classify it as a nuisance. The average homeowner encounters it as that annoying green mat creeping across the flower bed every spring. They spray it with herbicide, pull it out by the fistful, and toss it into the yard waste bin without a second thought. And that is roughly how modern medicine has treated chickweed for the past 150 years. As a weed, as folk nonsense, as the kind of thing your superstitious great-grandmother might have believed in, but nothing a serious doctor or pharmacologist would waste time studying. That attitude, it turns out, was a mistake, and the evidence has been hiding in plain sight for a very long time. The oldest surviving written references to chickweed as medicine come from Anglo-Saxon England. In the 9th and 10th centuries, English monks and healers were compiling collections of medical knowledge into manuscripts known as leechbooks. The most famous of these, a text known as Bald's Leechbook, dates to roughly the 9th century and is considered one of the oldest medical textbooks in the English language. It contains remedies for everything from headaches to infected wounds to what its authors called flying venom, which historians now believe referred to infectious diseases. Chickweed appears in several of these early English medical texts. The Anglo-Saxon healers recommended crushing the fresh plant into a poultice and applying it to wounds that showed signs of infection, to boils, to skin inflammations, and to painful swellings. They also described using chickweed preparations for eye infections and for soothing irritated skin conditions that we would probably recognize today as eczema or dermatitis. Now, it would be easy to dismiss this as medieval superstition. These were the same people who believed in elves causing illness and who sometimes included prayers and charms alongside their herbal recipes. Their understanding of why things worked was often wrong. They had no concept of bacteria, no germ theory, no way to explain infection at a microscopic level. This decision seemed small at the time. It wasn't. Because the fact that they could not explain why chickweed worked does not mean it did not work. And the Anglo-Saxons were not alone in figuring this out. Across medieval Europe, monastic herb gardens routinely included chickweed among their cultivated medicinal plants. Benedictine and Cistercian monasteries, which served as the primary healthcare institutions for much of the Middle Ages, grew chickweed alongside better-known herbs like yarrow, comfrey, and calendula. Monks documented its use for treating skin lesions, for reducing inflammation, and for soothing the kind of festering wounds that were an everyday hazard in a world without antibiotics or antiseptics. Meanwhile, thousands of miles to the east, traditional Chinese medicine had independently arrived at remarkably similar conclusions about the same plant. Chinese medical texts, dating back centuries, describe a plant called fan lu, identified by modern botanists as Stellaria media, used for treating respiratory infections, reducing fever, and addressing digestive complaints. Ayurvedic practitioners in India documented similar applications. The specifics varied by culture, but the core insight was consistent. This small, common, easy-to-grow plant had measurable effects on infection and inflammation. What comes next is the part that still doesn't make sense to a lot of people. If so many different cultures, separated by oceans and centuries, all independently identified the same plant as medicinally useful, why did modern science ignore it for so long? Part of the answer lies in the 17th century, with a man named Nicholas Culpeper. Culpeper was an English botanist, herbalist, and physician who published a book in 1653 called The English Physician. It was, in essence, a comprehensive guide to medicinal plants available in the British Isles, written in plain English instead of Latin, so that ordinary people could use it. The book was wildly popular. It went through dozens of editions and remained in print for centuries. Culpeper's entry on chickweed was detailed. He described the plant as cooling, soothing, and effective against inflammation. He recommended it for skin conditions, for infected wounds, and for what he called hot swellings. He noted that it could be made into an ointment, eaten as a salad green, or brewed into a tea. His descriptions were practical and specific, grounded in observation rather than theory. The physicians of the Royal College of Medicine absolutely despised Culpeper. They saw him as a charlatan, a popularizer, someone who was putting dangerous medical knowledge into the hands of people who did not have the training to use it properly. They attacked his work publicly and tried to discredit his recommendations. Some of this was genuine concern about patient safety. A lot of it was professional protectionism. Culpeper was cutting into their business by telling people they could treat common ailments with plants from their own gardens instead of paying for expensive consultations. Everything was in place for chickweed and dozens of other medicinal plants to be taken seriously by the emerging scientific establishment. Culpeper just didn't know what everything was building toward. Because what happened next was the exact opposite of what the evidence suggested. Instead of investigating why these folk remedies seemed to work, the scientific revolution gradually pushed them to the margins. By the 18th and 19th centuries, a revolution in chemistry and pharmacology was underway in the universities and hospitals of Europe. Researchers were learning to isolate specific chemical compounds from plants and minerals. They were developing standardized dosages, controlled preparations, and systematic methods for testing whether a treatment actually did what its advocates claimed. This was, in many ways, genuine progress. It replaced guesswork with measurement. It introduced rigor where there had been tradition, but it also introduced a bias that would persist for generations. If a remedy could not be reduced to a single active chemical compound, if its mechanism could not be explained in the language of the new chemistry, then it was not considered real medicine. It was folklore. It was superstition. It was the kind of thing uneducated country people believed in because they did not know any better. Chickweed fell into this category. Victorian-era apothecary shops across Britain still stocked chickweed ointments, and rural healers continued to recommend chickweed poultices for skin infections and wounds. But the medical establishment was moving in a different direction. The rise of patent medicines, mass-produced pharmaceuticals, and eventually, the germ theory revolution of the late 19th century pushed herbal remedies further and further to the edges of legitimate medical practice. And then, in 1876, Robert Koch identified the bacterium that causes anthrax. In 1882, he identified the one that causes tuberculosis. Louis Pasteur's work on vaccination and fermentation had already transformed the scientific understanding of disease. For the first time in human history, doctors knew what caused infection. They could see the enemy under a microscope. This was, without question, one of the greatest advances in the history of medicine. Germ theory saved millions of lives, but it also had an unintended consequence. It made the old plant-based remedies look even more primitive by comparison. How could a crushed-up weed possibly fight bacteria? The idea seemed absurd to scientists, who were now watching individual microorganisms under magnification. The folk healers had no explanation for how their remedies worked, so the assumption was that they did not work at all. Someone saw the flaw in that logic. Several people did, actually, but nobody listened. Then came Alexander Fleming and the discovery that changed everything. In 1928, Fleming noticed that a mold called Penicillium notatum had contaminated one of his bacterial culture plates in his London laboratory, and the bacteria around the mold were dying. He had stumbled onto penicillin, the first true antibiotic. By the 1940s, mass production of penicillin was saving the lives of soldiers wounded in World War II. By the 1950s, a whole arsenal of antibiotic drugs had been developed. Streptomycin, tetracycline, erythromycin. The golden age of antibiotics had arrived, and infectious disease, the greatest killer in human history, appeared to be on the verge of total defeat. And with that, any remaining interest in folk remedies like chickweed evaporated almost completely. Why would anyone bother studying a backyard weed when you could prescribe a pill that wiped out infection in days? The answer seemed obvious. The old ways were obsolete. Science had won. For about 50 years, that story held together. Antibiotics were miracle drugs. Doctors prescribed them freely, sometimes for conditions they could not actually treat, like viral infections. Agricultural operations began feeding antibiotics to livestock by the ton, not to treat sick animals, but to make healthy ones grow faster. The drugs were cheap, effective, and seemingly inexhaustible. If you're finding this helpful, hit subscribe. I break down forgotten history like this every week. While all of this was happening, something else was brewing. Something the medical establishment was slow to recognize and even slower to address. Bacteria were adapting. They were evolving resistance to the very drugs designed to kill them. By the 1980s, hospitals were reporting infections caused by bacteria that no longer responded to standard antibiotics. Methicillin-resistant Staphylococcus aureus, known as MRSA, became a growing threat in surgical wards and intensive care units. Tuberculosis, a disease that antibiotics had supposedly conquered, reappeared in drug-resistant forms. By the 2000s, the World Health Organization was issuing increasingly urgent warnings. Antimicrobial resistance was not a distant hypothetical. It was happening now, and it was accelerating. Their projections estimated that by 2050, drug-resistant infections could kill 10 million people per year worldwide, more than cancer. The golden age of antibiotics was ending, and the pipeline for new antibiotic drugs had slowed to a trickle. Pharmaceutical companies, it turned out, found antibiotics less profitable than drugs for chronic conditions that patients take for life. So investment in new antibiotic research had quietly dried up. And that is when some researchers started looking backward, not out of nostalgia, but out of necessity. In 2015, a team at the University of Nottingham decided to test one of the remedies from Ball's Leechbook, the same 9th century Anglo-Saxon medical text that had recommended chickweed for wounds. The specific recipe they tested was called Ball's Eye Salve, a preparation made from garlic, onion, wine, and bile salts. They followed the original instructions as precisely as possible, brewed the 1,000-year-old recipe in their laboratory, and tested it against MRSA. The results stunned them. The Anglo-Saxon preparation killed up to 90% of MRSA bacteria in laboratory conditions. A remedy from the 9th century was outperforming some modern treatments against one of the most dangerous drug-resistant pathogens in the world. That's not a typo, by the way. A recipe written down more than 1,000 years ago by people who had no concept of bacteria, worked against a superbug that 21st century medicine was struggling to contain. This experiment did not directly involve chickweed, but it did something arguably more important. It forced the scientific community to take medieval herbal medicine seriously as a source of potentially active compounds. If one old remedy could work that well against MRSA, what else might be hiding in those ancient manuscripts? Researchers began systematically investigating the chemical properties of plants that had appeared repeatedly in historical medical texts. And chickweed, Stellaria media, kept showing up on the list. Modern phytochemical analysis has identified a complex cocktail of bioactive compounds in chickweed tissue. The plant contains flavonoids, which are compounds known to have anti-inflammatory and antioxidant effects. It contains saponins, which can disrupt the cell membranes of certain microorganisms. It contains triterpenoids, vitamin C, and a range of other chemicals that, working together, produce measurable antimicrobial activity. Laboratory studies published in peer-reviewed journals have confirmed that extracts of Stellaria media demonstrate activity against several strains of bacteria, including some that cause common skin infections. The extracts also show anti-inflammatory properties that would explain why chickweed poultices reduce swelling and redness around infected wounds. The Anglo-Saxon monks, the Chinese herbalists, Nicholas Culpeper, the Victorian apothecaries, the village healers across 3 continents, they were all observing the same real pharmacological effects. They just lacked the vocabulary and the instruments to explain why, which, looking back, was either incredibly brave or incredibly stupid on the part of modern science to ignore for 150 years. This is not to say that chickweed is a replacement for modern antibiotics. It is not. Nobody is suggesting that you treat a serious infection by rubbing a weed on it instead of going to a doctor. The concentrations of active compounds in a raw chickweed plant are relatively low compared to a manufactured pharmaceutical. The effects are real, but they are modest when measured against the potency of even a standard dose of amoxicillin. But that misses the point entirely. The significance of the chickweed story is not that we should abandon modern medicine in favor of medieval poultices. The significance is that centuries of accumulated human observation, carried out independently across multiple cultures, identified a genuine medicinal property in a common plant, and modern science dismissed that observation as worthless for over a century before finally bothering to check. The emerging field of ethnobotany and what researchers call reverse pharmacology is now built around exactly this principle. Instead of randomly screening thousands of chemical compounds hoping to find one that happens to kill bacteria, which is how most modern drug discovery works, reverse pharmacology starts with plants that traditional healers have already identified as effective and works backward to figure out why. It uses history as a shortcut. The logic is simple. If people on 3 different continents, with no contact with each other, all use the same plant to treat the same kinds of conditions, that is not a coincidence. That is data. The clock was already ticking on this approach. Researchers just couldn't hear it yet. Because every year that antibiotic resistance grows worse, the urgency to find new antimicrobial compounds grows with it. And every year, more of the traditional knowledge about medicinal plants disappears as indigenous healing traditions fade, as elderly practitioners die without passing on their knowledge, and as the wild habitats where these plants grow are paved over or poisoned with herbicides. There is a deep irony in the chickweed story that is worth sitting with for a moment. The same chemical herbicides that homeowners spray on their lawns to kill chickweed are, in a real sense, destroying a potential source of antimicrobial compounds at a time when the world is running out of effective antibiotics. The weed people poison because they find it unsightly contains chemicals that might, one day, contribute to saving lives. And the knowledge that this plant had medicinal value was never really lost. It was just dismissed. It was sitting in manuscripts that historians could read, in folk traditions that anthropologists had documented, in the living memory of herbalists and traditional healers around the world. The information was there. The scientific establishment simply decided it was not worth investigating. That is changing now, slowly. Universities in Europe, Asia, and North America have established research programs dedicated to investigating traditional plant medicines using modern analytical techniques. The Ball's Leechbook experiment at Nottingham opened doors that had been closed for decades. Funding agencies that once would have laughed at a grant proposal involving medieval herbal remedies are now taking them seriously. Not because anyone has suddenly become sentimental about the past, but because the present situation is desperate enough that ignoring potential solutions is no longer an option. Chickweed is one small piece of this much larger puzzle. It is not a miracle cure. It is not going to single-handedly solve the antibiotic resistance crisis, but it is a vivid, tangible example of something that should make us uncomfortable. For all of our scientific sophistication, for all of our technology and our laboratories and our peer-reviewed journals, we spent a century and a half dismissing knowledge that turned out to be real. Not because the knowledge was wrong, but because it came from the wrong people, in the wrong format, without the right credentials attached to it. The next time you see that low, green mat of tiny white flowers creeping across your garden, it might be worth pausing before you reach for the weed killer, because that plant has a longer medical resume than most of the drugs in your medicine cabinet. It was treating infections before anyone knew what an infection was. It was reducing inflammation before anyone had coined the word. And it is still sitting there, in the dirt, doing exactly what it has always done. What survived this story is not just a plant. It is a reminder that knowledge does not always move forward in a straight line. Sometimes the answers are behind us, buried in old books and neglected gardens, waiting for someone to take them seriously again. So now you know the hidden medical history of a plant that most people throw away without thinking. If you want to see how another useless natural substance turned out to have extraordinary properties science almost missed, that video is on screen now. Hit subscribe so you catch it when it drops.